It's Dr. Robbie White, Chief Clinical Officer for Ergo-Flex Technologies, home of the Back on Track, Knee on Track, and Total Brain and Body O2. But today is all about the Back on Track. So we got Dr. Cross, we got Dr. Weiss. Hello, hello. We're going to have a few more joining us shortly. If you have any questions, please, in the chat section, hit me up with some questions. Very, very important. Today is really all about the Back on Track and how it can make a huge impact for your patient outcomes and your clinic's bottom line. So let me start off with sharing some pre and post X-ray and MRI. So guys, can you see this? Hopefully you can. Let me go back. So this gentleman, this is actually Dr. McKinney. Dr. McKinney sent these in. It's a middle-aged male with back pain, sciatica, and basically what you can see here is that there is some positioning issues. You can see that one hip is in front of the other, so there's rotation. There's also lateral flexion in the pelvis, as you can see here. But the biggest issue is that, gosh, L5 is just completely jammed up against the sacrum. The IVF is almost non-existent, especially when you start taking a look here and here. So these disc spaces are not fantastic. This one's really good. That one's pretty good. But when we start looking at what's happening here and here, we start to get a little more concerned. This one is just an absolute nightmare. So Dr. McKinney sent these in and let us know that, hey, he did a 24-visit protocol with the Back on Track. He did chiropractic adjustments. He did myofascial release. And that was his protocol. So he did 24 visits over 3 months. So 3 times a week for 3 weeks, and then 2 times a week the whole gig. He didn't have any specific on that. And that would have been my recommendation as well. I would have done 3 times a week for 8 weeks. I would have done 24 visits over 2 months. But patient had absolute pain relief, increased his function. But then let me show you the actual... I remember how to do this now. Post X-ray. Nope, nope, nope. I missed it. Let me share post X-ray. Here we are. So that's the post X-ray, which is pretty amazing stuff. Let me take a look here. How many people we got? So 24 visits over 3 months. You can see that we have a significant improvement in how we can actually visualize the L5 disc. The L5 S1 IVF is in good shape. You can still see that here, hey, this is still in trouble, so definitely make recommendations for continued wellness care in this event. This disc height hasn't changed too much. This one's in good shape. This one, but the other thing you'll notice, I don't know if you can see both, is the alignment that you have here. This alignment is critical. Let me go back into here. Ah, look, I can actually, man, it's like magic. So the alignment, we have this big angle that we have here, all right, compared to this. Now, I started practice 2000. Shortly thereafter, I started using all kinds of different techniques that included traction, started out with the old Hill anatomotor, and then quickly advanced to some more straight axial. In 2006, I actually bought a American Back Systems, which is a repackaged DRX 9000. And I have been going full bore with non-surgical spinal decompression since then, since really the beginning of my practice, and never once in all of those pure axial decompression tables or axial traction tables did I see a curve restoration and this kind of change. Okay, when you take a look at this one, you can see exactly what's happening in the rotation. So this patient didn't have real good positioning on their X-ray. All right, now that may have been antalgic in nature, but when you see here, this and here is much, much better. So not only does it correct the disc height issues or significantly improve them, but it corrected the pelvic rotation, and the lateral flexion events as well. You just don't see this very often with straight vertebral axial decompression and in conjunction with adjustments. It just doesn't happen that much. And there's a very specific reason why. There is a neuromuscular re-education event that occurs on the back on track because of the proprietary automated lateral movements, okay? So in other words, if I'm using protocol K, I'm moving feet left, and I am opening up the right IVF. It's also creating a rotation event, okay? So if feet go right, if feet go left, there is a right rotation event at the vertebral bodies. That means the pelvis rotates right. Laterally flexes left, but there's right rotation. When feet go back right, there's left rotation and right lateral. So we are not just pulling straight, right? There's an entire complex movement that's occurring when feet move left and right. And when you add axial decompression, that's what makes it such a powerful piece of equipment, okay? So let's take a look at this. Anybody have any questions? Hit me up with some questions. Dr. Weiss, hey, JT's on. He's on the Florida tour right now. He's out taking care of docs. Good to have you on board, JT. Dr. Cross, if you have any questions, please fire them off to me. I am going to go back in and I want to show you what Dr. Ma sent us. He has a similar event. Let's see. This one, yes. And that one, I think I have to do both. Okay, so that is actually not the one. I want to, what you see right there is actually the, there we go. Okay, so this is the pre-MRI. Now, as you can see, a 35-year-old male, he presented to Dr. Ma with severe low back pain and severe right sciatica. Now, this MRI was done approximately 6 months prior to him actually walking in Dr. Ma's clinic. And of course, what you see is, hey, look, good hydration here and here and here. When we start looking at what happens on the MRI, we've got good spacing here and here. Then you start to see the loss of disc hydration, and then we have a mild disc bulge, and then at L5S1, we got a severe protrusion. And that was what we predicted was actually creating the issue with the sciatica. Notice that now this was a static MRI, wasn't a, it was a supine, so it was laying down. Excuse me. So, but you can see he's got a loss of the curve when he's supine. Let's take a look. This is post. All right, guys, so that's post. When you take a look at L4 and L5, you see a significant improvement here and a massive improvement here. Now, notice this was taken in October of 2018. The previous was February of 2017. Okay, so when you do that, well, you see, well, there's such a big difference now. So basically, this MRI got done about 6 months after he stopped care. Okay, so Dr. Ma let me know he did 24 visits of chiropractic in conjunction with myofascial release. They did do some home exercise and physical therapy, a little bit in the clinic, but back on track. Okay, and in this case, he did use a progression protocol, starting off in axial, then moved to a lateral, then moved to bilateral lateral traction. And what you see here is pretty amazing stuff. Let's see if I can put those side by side. It's technology, guys. I don't know about it, but you can see right there. That's pretty amazing. So this is the post, and this is pre. All right. Now, his primary care, excuse me, is the one that ordered these. And you can see that in his post, he actually has an improvement in his supine curve. All right. There's not a lot of change in disc hydration, and that's something you see on a pretty regular basis, but that's pretty amazing stuff. That is absolutely amazing. Let me pop in something I got today. All right. So this is going to be a little bit different. I'm going to talk about this one because this is a knee patient that I have a doctor that Dr. Altoff asked me about today. She asked me about the knee on track. I know this is the Back on Track webinar, but the reality is that you better be treating the low back when you have an issue like this. Loss of medial joint space and lateral joint space. What that basically means is that the 6 muscles on the front of the knee and the 6 muscles on the back of the knee are in trouble because there's a neurological deficit. That neurological deficit is most likely not coming directly from this knee joint. Right? It is going to be coming from L4 and L5. So if you're treating knees or you got a patient who has knee pain, you better be looking to the spine. Now this is, and she just showed me this x-ray. This is the one that she showed me originally. And I told her, hey, yeah, absolutely going to be a great candidate for the knee on track, 24 visits over 8 weeks. As a matter of fact, I'd suggest that you treat both knees because we're having a loss of medial joint space there. And I definitely recommend that you treat the low back, specifically with the Back on Track. And she said, that was my plan, and this is why. So she is ahead of the game. She's working it up. So this is it's really hard to see with all the yellow lines, but you can take a look. This patient has significant joint space loss throughout the spine. Got a grade 1 spondylolisthesis L4 on L5, and actually what appears to be a retrolisthesis of L5 on S1. Loss of disc height, the IVFs are in trouble. So absolutely, in this case, I would recommend 24 visits 3 times a week.
Dr. Wyatt?
Yeah.
We aren't able to see the knee. We only see the MRI of the spine.
Okay. Oh, thank you. Why is it not? Dun, dun, dun. Let me go back. Oh, I know what I got to do. What about now?
Yep, there it is.
All right, perfect. Thank you, sir. So that's the knee. So this is right knee. You see that medial joint space loss, and then the lateral joint space loss, and again, medial joint space loss. So she was asking me specific, is this patient a good candidate for knee on track? Absolutely, but you better treat the low back. Now, I've got to go back to this. Then I need to share and go here. Okay. Now, can we see that one? It should be good.
Yes, sir.
All right, thank you. So what you see is that anterior spondylolisthesis, grade 1, L4-5, and then there's actually a retro here, okay? So protocol O is the one I like so much for the any patients that have spondies, whether it's anterior, posterior spondylolysis, spondylolisthesis, pars defects, transitional segments, all of those are very, very powerful. So, and the reason why is that axial decompression, axial distraction basically interferes with the interspinous, intertransversarii, the iliolumbar ligaments that are in constant tension because of the anterior or posterior translation. So when you go in there and do repeated axial distraction, it doesn't like them very much at all, okay? So that's why I like static axial, like in protocol O, and then it does sweep left and right. Now we do have a protocol that does just a sweep to one side if you want to do that as well. So that's what makes things so powerful in relation to that. Let me double check. Okay, we're going back. I can't see the knee. Woohoo! Thanks, guys. Thanks, Dr. Guerrero. Okay. Like I said, technology and me are not the best. What kind of questions do y'all have so far? Let me go through. One of the big ones I always get, who we got? Dr. Peer, Dr. Weiss, good day, sir, good day. We got Mercedes, we got Dr. Guerrero, we got Donnie. Donnie's on board. Woohoo! Thanks, guys. So, if you have any questions, right down here on the right side on the chat, I'll just pop them in there. That'd be great. One of the big ones is, how big is it? If you don't have it, he basically takes up a 5x7 footprint. One of the things that you need to do in regards to that is if it's a really tight spot, you don't have you don't have a lot of room, you can slide the back on track up against the wall. It needs about 14 inches of movement away from the pad, okay, up to the wall. And then you can actually stand on one side and adjust the arms by swinging the arm up and above. It took me about 4 years to figure out that you can stand on the same side as the control, swing the arm up and adjust it there and then back. For 3.5 years, I was training not only myself, but staff members to walk all the way around the table to set the arm. It works really well if you stand on the same side that you're on and then move from there. Someone's texting. Okay, so you need a 5x7 space. Doctors typically, I recommend a 12-minute protocol, and here's why. The duty cycle on the actuators work at 1/10 of the time you set. So in other words, if it's 12 minutes, it's going to hold that position for 12 seconds, okay? If it's 10 minutes, it's going to hold it for 10 minutes. If you set it at 6, it's going to hold it at 6. So why a 10 or more minute protocol? And I like the 12-minute protocol because of the Hoffman's reflex. So when you put, what makes the back on track so powerful is that we are strengthening and lengthening muscles through the movement. The other thing is that there's no harness system, so there's no body entrapment system. The body entrapment system, like you find on a DRX 9000, mainly activates muscle spindles. Okay, muscle spindles, when you activate, you poke on a muscle spindle, you strengthen the muscle. You actually make it go into contraction. So the other thing you have to do, what the back on track does so well, is it activates Golgi tendon. Now, Golgi tendons relax the muscle when you activate them. So we want to strengthen and lengthen. So Golgi tendon lengthens or relaxes the muscle, and the muscle spindle strengthens or shortens the muscle. So when you're using this lateral movement that creates rotation and then lateral flexion in the spine, and there's not any body entrapment system in place, that means we're not fighting as much of the muscle guarding that you get when you're using a body entrapment. Okay, so when you're using one of those systems, and they're great systems, I've used them for years, the problem is that you got to pull longer and harder. So that means instead of a 12-minute protocol, I've got to do a 25 or 30-minute protocol because I've got to exhaust that muscle because I'm activating muscle spindle, creating a contraction. I got to pull through it, okay? This is the foundation of all of chiropractic biophysics, which is fantastic stuff. I use it on a regular basis. But all of their protocols are 30 minutes or longer, and they're pulling at 100, 100 plus or 50% of the body weight. It's very uncomfortable because they're not activating Golgi tendon. All right, so that's why I like the 12-minute protocol. 12 minutes means it's 12 seconds in position. So when you get when you move feet left, like in protocol K, it's going to take about 6 seconds to get there. And then once it gets there, it's going to hold it for 12 seconds. And then it's going to come back to midline, and it's going to cycle through. And then it's going to move left. And then it's going to cycle through that one. And that 12-second hold actually activates the Hoffman reflex, which is the same reason why PNF works. So if you bend over and try to touch your toes as best you can and hold it for 10 seconds, after 10 seconds, you can actually go further because of the Hoffman's reflex. It actually allows the muscle spindle to relax a little bit. And suddenly, when you activate it again, you get the stretch relax. So that's why PNF works. It's the same thing that the back on track is doing, okay? It's doing it automatically. So that's why I like the 12-minute protocol, because we activate the Hoffman's reflex very quickly. Excuse me, very effectively. Well, doctor, if it only takes 10 minutes, 10 seconds to activate that reflex, why are you recommending that we go to 12 seconds? Because people fidget on the table when it moves, that original. So if they have 2 seconds to relax into that new position and they're not moving in it, which is the key to this, then that is one of the best ways to make that happen. Hey, Dr. Cross, you've got found a way to adapt the unit to a patient who has shoulder issues, and not aggravate the shoulder. The best way to do that is to simply not use the arm bolsters, okay? I appreciate that question. You just basically don't use the arm bolsters. You take a piece of drawer liner material and you put it under the upper back, under the thoracic spine, and then you add an inch to whatever you're pulling on that, okay? I can tell you this, Dr. excuse me, JT has officially, we've begun an adapter for us to be able to apply a thoracic harness, okay? It's under construction. I've taken a look at it. It's actually really nice the way it's going to be set up. So there are instances where the thoracic entrapment system would be effective, especially with somebody that has a shoulder issue. So personally, I've got a shoulder issue, and it's not fun sometimes to be on the back on track because of that. So I certainly understand your concern and your question. But in the meantime, with just simply unhook their arms from the bolsters, add an inch to what you're pulling on, and you will get very similar results, if not better results, because they're actually now they're now resting or comfortable in that position. This is not a system that we have to pull longer and harder with because of the neurological mechanism I just talked about. I don't have to have, it doesn't have to be a deep stretch. It just doesn't. Neurologically, we don't have to push the patient to that level. There are doctors that use it that way and they get results, okay? It's definitely something that works, but I'd much rather have my patients get up off the back on track, walk away feeling great, because that is an immediate internal referral source. All you got to do is simply ask them, right? How great do you feel? I feel great. Who do you know that could benefit from this? If you train, either you do it or you train your staff to ask those questions, you can increase your internal referral sources by 50%. 50% of all your new patients will send somebody in that's because they're going to need the back on track. It's just the reality of it. I would simply, if we were low on new patients from our marketing, guess who went over to the back on track and started asking those simple questions? Me. And then I'd train my staff up to ask them. And I'd bolster the internal referrals that way. Okay? It takes 5 minutes to train your staff. Excuse me, man. 5 minutes to train your staff to get you new patients. It's not that hard. All right, guys, if you have questions, please ask. I appreciate that question, Dr. Cross. It's awesome. What are the other common questions? So cost and let me grab this real quick. Cost, see if I can find this. And what do we charge? So cost per visit, and can I bill for it? You can bill. Typically, I've got docs that charge anywhere from, on a cash basis, from $55 to $105 a visit. Pay as you go. Here's my stuff. And that's on a cash. And we did that on a regular basis. In practice, my back on track session was $60 per visit if you paid as you went. We gave discounts based on past that, but where is my can't find it. So now, if you want to bill it, you certainly can. Conditions, CPT codes, there it is. Okay. Now, these CPT codes come directly from me. These are not something that Ergo-Flex is recommending. This is directly from me. Let me do this real quick. Where is it at? There it is. So these are the CPT codes that are viable for the back on track. So 97110, therapeutic exercises. 97112, neuromuscular reeducation. You can use 97012, mechanical traction. If you'd like, the S9090, non-surgical spinal decompression code, the vertebral axle decompression. 97139, unlisted therapeutic modalities, and 97530, therapeutic activities. The reason why I say you can do this is because of the neurological mechanism that we were talking about earlier. Okay? If you're lengthening and strengthening muscles, you're creating exercise. You're also doing neuromuscular education. It does do mechanical contraction. FDA's definition of non-surgical spinal decompression is the body in position under distraction. Unlisted therapeutic modalities. This one is there basically because if you're using a bunch of 97110 or 112 already, you don't want to flub it up by adding another 110 or 112 on top of it. So this option works as well. And then 97530, therapeutic activities. You can cycle through all of these or not. It's up to you. This is on our online resource center. If you haven't been on the online resource center, it is constantly being updated. There's all kind of new stuff. We just revamped the clinical documents to be in a much easier, accessible place. So if you want to bill it, or if you just want to have an internal code, personally, we were all cash practice. We just made, guess what? CABOT, cash back on track. That was our internal code. If you want to use S99, you can. That is it's a non-reimbursable code. The rest of these are. I don't recommend 97012 unless you make it a cash code. Reimbursement on that is at best like $12. So you can bill this under that. Now, the other big one is, why can you do that? Well, because the system is FDA registered with a 510K exemption. Understand it's an exemption. It's a class 1 powered exercise equipment. So that means that any type of exercise that you can think of that you're doing with the Back on Track makes it a billable code, okay? However, it is a cash cow. It will make your clinic tons of money, and patients love it, and they want more of it. So it is just, for your bottom line of for your practice, it's unbelievable. And one of the things I tell doctors all the time is, do not invest in equipment to get new patients, okay? I did that for years. I was looking for the next shiny object that was going to help me get new patients. The reality is that I got more patients when I invested in equipment that got me better patient outcomes. Once I got better patient outcomes, I had more confidence and I knew exactly who I could and could not help. That means I had more new patients, okay? So very specific. As a neuropathy solution to Back on Track is you won't get the same results unless you're using the Back on Track with your neuropathy patients. Low back pain and sciatica, mechanical low back, all those different things make a huge difference. The Back on Track is the simplest, easiest, most powerful way to make that happen. It is a fire and forget mechanism. You basically set the protocol for 4 visits and you have your staff do it. At the 4th visit, you reevaluate if you need to make a change. If you need to make a change, if you need to add an inch, or you need to change the protocol to go into a lateral movement or bilateral movement, you make a change. It's fire and forget for every 4 visits. That's what I recommend. Basically, you put it in place, 4 visits later, you make sure it's doing its job and the patient's better, and you change something. It's that simple, and patients love it. It adds value to your overall services, okay, which is critical. It gets you better patient outcomes, which 90+% of the time you can see in a pre and post x-ray. I'm showing you x-rays that doctors are sending to me, and I look at it and I say that's normal because that's what I've been getting for years and years and years. A lot of the times docs don't do post x-ray because they don't want to see what's happening, because they don't know if they've really made a change. If you haven't made a change, it's pretty simple. Either it's not working or you need to do more of the same and get more results, right? So when you start investing in equipment that that gets you better patient outcomes that you can put in black and white on an x-ray and show the patient, this is where we were, this is where we are now, this is where we need to go. Talk about what your compliance goes up significantly. Anybody have any other questions for me? We're about to pop out of here. All right. All right, guys. So, hey, Dr. Pierre, I appreciate it. He said it's been a great addition to his office. I don't want, man, I got a frog in my throat. I've been running. So, September. Now, this weekend, we're going to be in 2 different places. We're splitting the team up. Linda's going to be at AFNI 2, American Functional, with Dr. Barlow. JT, who is already in Florida, calling on docs, pretty much all the docs that he can get to answer the door
in Florida. He's going in and talking to them. He's in Florida. We're going to be at the FCA, Florida Chiropractic Association National Convention this weekend. We're flying out tomorrow. We'll be there through Sunday. So 22nd, 23rd, 24th, and then 25th. So if you're in Florida or if you got plans, definitely come by and see us at our booth, okay? We're going to have Sandy Arthur there. She's going to have some great artwork for us. We're going to be debuting our Total Brain and Body O2 console, the clinical model, which has, in addition to our performance model, basically takes all that great piece of equipment, puts it in a smaller package that's a lot easier to put inside your clinic. Of course, we're going to have the back on track and the knee on track, all kind of great stuff. And September 27th and 28th, Secrets to $1 Million Practice here at headquarters, our world headquarters in Conroe, Texas. I'm going to go over a lot of what we just talked about today in much, much greater detail about the knee on track, about the back on track, in the Total Brain and Body O2. If you haven't heard anything about that, get over and see us, okay? We still have some tickets. Tomorrow is the last day. They're going to be at $149. After tomorrow, they go to $199, guys. And that is a great value. You can also get CEs included with that if you'd like. So September 27th, 28th, I think we're pushing right at the 40 doctor limit right now. We got 40 docs coming in. We've only got 10 more seats, guys. Otherwise, we're going to have to rent a bigger venue. I just don't know if we have time to make that happen. So get online, get your tickets, go to Ergo-Flex.com, take a look at our online resource center and the Secrets to $1 Million Success Practice Seminar, and get your tickets today. Absolutely, absolutely great stuff. We got all kind of great things happening. So if you're going to be in Florida at FCA, come see us. If you're going to be at AFNI, Linda's going to get you all taken care of. And then definitely make your way in for September 27th, 28th for our big secret seminar. By the way, we're giving a back on track and a knee on track away at that. That's worth the price of admission right there. Okay, we're giving away $18,000 worth of equipment at that show, plus cash prizes, all kind of fun stuff. So thanks, guys. Have a great one. I appreciate it. Keep saving money.